Hey everybody, guess what? We're live this morning. We have Elizabeth back with us from Caregivers by Wholecare. Good to see you again.
Good morning, Donna. It's great to see you too on
It's
this
been,
humid Wednesday morning in
I,
Nashville.
I know. We were just talking about that. I got the curls coming out because it just wasn't gonna, the
Yeah.
straightening wasn't gonna happen after being out this early this morning. Hey, last time we talked, it was kind of at the beginning of the whole shutdown when everything was starting to close down. People were staying at home, and you were talking about providing care for people in their home. Tell us what it has been like since that time we talked a few months ago.
Well, people are still needing and wanting to be home. There's been a lot of change. I don't remember exactly the date that we talked, but I believe I was very busy sourcing the protective equipment for the caregivers and the clients to prevent. I am happy to report, and we're excited about this, that we set a goal in the beginning of this that we would have 0 incidents of COVID. And we've been successful in that.
Wow, that's impressive. That alone is impressive to me.
Yeah. And especially because caregivers do care for multiple clients. But we provided the PPE for each client and each caregiver, and had specific instructions on leaving your reusable masks at the client where you use that, and not using PPE for multiple clients. So we were, I was diligently thinking through all that, obviously, or hopefully not obviously, because all home care companies haven't done that.
Right.
And I believe it's because I'm a nurse that it just comes natural to think about those things. So protecting the caregivers and the clients. With that said, some of the changes that we would have had no idea, even at that moment, that would have happened were that the unemployment that was given to everybody, anybody and everybody, even if they had a job and could still work, they were given a substantial amount of income that exceeds what their income is as a caregiver. And so we've lost some caregivers because that's more money.
Yeah.
That's a challenge. It's been a challenge. And then also some clients opted to stop services because they didn't want anybody coming in their home. So we've seen up and down situation. We were supporting a facility that had some employees that were positive, and we backed them up. I think that was in May, and then their employees came back and they didn't need us anymore. And so there's been a influx, very short-term influx of various different things that we've seen. And we still are hiring. We're constantly hiring. We never stop hiring. So, healthcare workers are heroes these days.
Right.
And they were considered essential, which many people are essential in their roles.
Right.
But caregiving in the home is essential. These older adults have to have somebody come in and care for them, and that's where they choose to be, is at home. 90% of older adults choose to be at home and are at home.
Yeah, that makes a big difference. And just before we start, we're talking about technology. There's one thing you cannot replace with technology is caring for someone. Like, you still need that personal touch in your home or wherever you are. You still need that person.
Absolutely. And if not only for physical care, because who wants a robot bathing them?
Yeah.
And we were talking about robots, the Amazon delivery robot.
Yeah.
Scout,
Yeah. Yeah, the
Scout?
Amazon Scout that's just come to Franklin. We were talking about that. Yeah.
And then the robot that's the inventory monitor at Walmart. So granted, there are robots in facilities that do probably pass medications or pass trays or empty garbage or, the tasks. And bathing is a task. However, I'm not sure that a robot could safely and in the split second moment adapt or shift what they need to do because of what another person is doing or not.
Right.
And with that said, we have openings. We're actively hiring. If you've never been a caregiver and you have a passion to care for others, we want to talk to you because that's what we hire. We hire based on passion for people. And we have a training program that we can take you from a no experience to level 1 experienced caregiver, and a level 2 and a level 3. Those are the 3 levels of care that we have and the 3 levels of skills that we train for.
So you mentioned the different levels. So let's say someone has no experience and they are looking for something. What types of things would they be doing if they were hired?
They could drive.
Yeah.
Lots of people need to go to the beauty shop, the grocery store. They want to shop. Of course, we all are wearing masks these days when we do those things.
Right.
And in our vehicles, we do wheelchair accessible. We have a wheelchair accessible van, and we transport people who are in wheelchairs to dialysis appointments. Of course, they'd have to be trained on the van, but if they had, that's pretty easy.
Yeah.
But driving, meal preparation, shopping, companionship, getting the mail and opening it for them, light housekeeping. There's multiple things that people really do need help with in order to stay home.
Right. Right. So that gives a good idea of where you can start. Obviously, your level 3 is someone who's probably a registered nurse and who can handle maybe medications and those types of things.
Well, we don't have nurses.
Okay.
We have certified nurse technicians or certified nurse assistants, but we're non-medical in nature at home. If somebody needs a registered nurse, they typically don't in the home.
Okay.
They would need that in a rehab environment, or home health could come into the home for the period of time that they do need that nurse. But we're the long-term extended care providers. Specialty care, yes, but it means that we're a higher skill level of caregiver rather than the typical industry term for what we do is sitters.
Okay.
And we're not sitters. We don't, and because that implies that you just go sit. Well, that's not us. Even though we do provide companionship, we provide advocacy. So we are a second set of eyes and ears, like in a hospital environment. If somebody needs a caregiver in the hospital or even in a nursing facility, then we are that advocate for that person, but we're actively engaged with the care plan of that person. We create a care plan. It is a nursing care plan. However, it's non-medical in nature.
Okay, that makes sense.
Okay, good. I'm glad that makes sense.
Yeah. I'm glad you cleared that up for me. I don't think I realized that. So you guys are hiring right now. How can people apply for jobs?
They can go on our website, www.caregiversbywholecare.com. You can call us and ask for Adriana. Our phone number is 615-298-9201. You can go to indeed.com and respond to a post there. You can go to mycnas.com and respond to a post there. We want to hear how you found us. And so please refer to the Morning Source. If you are listening to this interview this morning and you see us there, we want to know that it's the live interview or Morning Source, or however you describe how you heard about us. We want to know that.
Great. And then for people, like you said, you're still taking on clients. So for people who maybe are rehab, or maybe they have an elderly parent or someone that they want to make sure that they have someone there with them, you guys are still able to take clients at this time, right?
Absolutely. And please know that we are doing absolutely everything to protect your loved one from COVID. Again, we've had 0 incidents of COVID. We have some videos out there to talk about specifically what we've done. to protect everybody. We have all the equipment now and are going to continue using that equipment. All 50% of our caregivers are COVID trained. And so please feel, confident when you call us that we can help you. And you could call and talk to Dixie Hayes, who's in our office at 298-9201, or go to our website, caregiversbywholecare.com, or, email us through info at on the website. You can find us. We have some technology that I'd like to talk about. It's our Wholecare Connect app.
Oh, yeah. We mentioned that the last time you were with us. Yes.
Yes. And you can find that on your app store, whether that's your iPhone or the Android system, either one, it's on there. And what that does is it allows you to create a team for your loved one, and you're a part of that team, and you build a team. It's the Spoken Hub. So you build a team, and when your loved one needs something, instead of a group text, you always have to go back and do you want everybody on that group text to know everything? Then you have to change it. But if you build the team around you of healthcare and who's going to really support you. And so when you put a message on there that I need help at 5:00 today, it goes out to everybody. And the first person that responds, everybody knows about it. So it's such an efficient system for your circle, your tight circle of support, to know in real time what's going on with you, when you need help. There's now a calendar inside that app. And if your request doesn't get response from your circle, we will get tagged. We will get an alert if you want our help. But the app is free. You can go get it. And, we're happy to talk to you more about that. And Paul Ellis is the one you can talk to in detail about that by calling 615-298-9201. We have a lot of resources. We are very helpful to help people find resources. We actually also have an ebook on our website. And so if you go to our website and look for the Caring and Sharing Resource Guide, click on it. You'll have to type in your name to get the ebook, but it's a free resource and it's extremely valuable. And you don't have to live in the Nashville area for it to be valuable.
And tell me what's in the ebook. What can they find in there?
It's a letter to a family caregiver, letting them know that there is help, first and foremost, that this is a journey.
Yeah.
And to please take care of yourself. And then there are checklists for the family caregiver to assess themselves in self-care. There's driving checklists for the person you're caring for, if that's a question you have. So every resource in there addresses a question or a need. And so then there are, how to hire a caregiving company, what to look for in that caregiving company. What's the difference between home health and home care? What is hospice care? What is rehab? What does the Council on Aging offer? What happens when you're a long distance caregiver, family caregiver? How do you manage that? There's letters of experience from people I've known that have been in those situations. There's a letter from a friend who cared for her mom with Alzheimer's for 16 years. It's a very sweet letter, and it's very depictive of the journey of caring for someone with Alzheimer's for a very long time. And so it's just full of, various personal things and self-assessments, and then notes if you go to an event or attend an event. Then you have a place to take notes.
Yeah, that sounds like a great resource, especially for anyone who is, like you said, a driving assessment, trying to figure out when it's time to hang up the keys to the car.
Or how to go about having that conversation, because everybody is very different. Men and women are very different about that. And I don't think this is in there, but I read a book It was a book about purchasing and how men and women buy differently. And one of the things that I took away from that is that when I'm talking to men who are talking to me about caring for their wife, I would not use the term help, because men don't need help. I would use the term support or assist.
No, yeah.
And so it's things like that that we know that, come across very differently than other people in these situations. But first and foremost, we want you to be proactive in this journey, because it's an at-need service. Most of the time, people wait until there's a crisis, and we can help prevent the crisis.
Right. I think we'd all prefer to do that if we can.
Yes.
Hey, it's great to catch up with you again. You guys go check it out if you need that, or even if you don't. I think it's good to keep this in mind, because you never know when that moment's going to happen where you do need care, or you need to find care for a loved one. And it's always good to know that these resources are available.
Yes. And again, our website is www.caregivers by Wholecare.
Caregivers by Wholecare.
Yeah.
All right.
Thank
Elizabeth, take care of yourself. I'm sure we'll check in with you again soon and see what's happening, maybe in a couple other months.
Yes. Thank you, Donna. Have a great week.
All right. See you, everybody. Bye.
Bye.